I think a lot of people can relate to what I'm going to say right now. I loved the job. I love it on paper. It was my primary task in this role was to spearhead and lead a community coalition to improve maternal and infant health outcomes. I also supervised community health workers, created the work plan. It was on paper, it was Christie's dream job. You know, I was working with women's health, prevention, all of these things that I love, facilitation. But the work environment was one of the most toxic places and experiences I've ever had in my life. So much so that by the end, I was clinically depressed and needed to walk away. I didn't have anything lined up. I just couldn't take it anymore.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 28. How's everyone doing? Hi, everyone. My name is Omari Richards. Thank you so much for logging in to check out the show. You all know I definitely appreciate all of you that take your time to listen and watch the show. Definitely, if you have not yet subscribed, review, leave a like, share this with a friend. I greatly appreciate it. I know that this episode has a lot of value, a lot of great books, so definitely get a pen and a paper or have your phone ready to write down notes of different books and different resources in that the guest shares in this episode. But it's definitely a great one, and I hope you enjoy. Quick note, I just wanted to apologize in case the audio isn't as clear as it usually is. I am in Gainesville and not in North Carolina, and I planned to be in North Carolina, so I don't have my mic with me. So my apologies, but enjoy. Without further ado, here's today's episode. So I am absolutely glad that I got to have Christie on today. She definitely has had a great journey and shared some really personal as well as some very informative information for public health people interested in public health. So I definitely hope that you all take notes of the books that were in this and go and follow at how to talk to your doctor. And yeah, I appreciate all of you for listening, and definitely if you haven't as yet, subscribe, leave a review, like this, and share it with a friend. I appreciate you, and I hope that everyone has a great week. See you all next week. Public Health Millennial out. Today, we have a public health professional with over 15 years of experience of conceptualizing and designing results in public health education. She has a Bachelor's of History in Genocide Studies and International Relations from Manhattanville College. She then completed a Master's of Education at Manhattanville College. After this, she went on to volunteer for the Peace Corps as an HIV community resource volunteer in South Africa. When she returned to the States, she worked as a reproductive health educator for Planned Parenthood. And in 2019, she left for Australia to get her Master's of Public Health at Monash University. More recently, she has founded her company, CVH Consulting LLC, in 2014, and founded How to Talk to Your Doctor earlier this year. You can find her on Instagram at Christie_Public Health. We have Christie VanHorne, M.Ed, MPH. Welcome to the show, Christie.
Hi, thanks for having me.
Yeah, it's my pleasure to have you on the show today. I'm glad that we can find some time to sit down and chat about your story and everything else.
Same.
Yeah.
You've had some of my favorite public health folks on this show, so I feel like I have big shoes to fill.
Well, I'm glad to hear that. I think this is going to be episode 28, so I'm glad that I got some good people on in the initial episodes.
Leonora, Leah, Shelby, all my favorites.
Yeah, I'm glad to hear that. Yeah, they are really great. So if you haven't listened to those episodes, definitely go back and check those out, everyone. So how are you doing? How have you been coping during these times?
Currently I'm doing well. As we all know, it's been a challenging year, right? But I'm grateful for my family and hot baths and a full bookshelf. Those three things, I think this year has really put things into perspective. So yeah, I'm doing well right now.
Okay, awesome. Well, what is something that's on your bookshelf?
Ooh, Mari. Now this I could talk about all day. It's probably a lot of people listening right now are like, oh, Christy, you can talk about books. If you just want to talk about books, we can. What am I reading right now? Well, this is right next to me. Everything Below the Waist. Why
Okay.
Healthcare Needs a Feminist Revolution.
Okay.
I'm actually referring to it for a training I'm doing, but I love to read, and I love to read like public health related books. I just finished Pandemic 1918, and that was a really interesting insight to the differences of these two pandemics, but also the similarities and the parallels were frightening when you consider it's 100 years later. So that's another book that I recently read.
Yeah, that's still fine because I didn't prep you on this. Yeah, but awesome. But thanks for sharing those books. And I know that you have like a book club, I put a section in the show. We'll talk about that a little later.
Okay, perfect. We'll talk about it later.
So, how do you identify, and tell us a little bit about your personal background?
Yeah, so my preferred pronouns are she, her, hers, and I live in the Hudson Valley of New York. So I live about an hour north of New York City. It's really beautiful here. A lot of people don't realize what a gem just outside the city, that it's just gorgeous. If you ever have the chance, come visit. I'm happy to show you around when, COVID's over. And otherwise, I just have an incredibly supportive partner, husband, and I am the proud dog mom of 2 dogs. And that's my life, really. You know it all now. I love public health, dogs, and reading. That's me.
Okay. We know Christy now.
Yes, you do.
So, what does public health mean to you?
I love this question. Public health to me is obviously about improving the health of our communities, right? But for me personally, it's also about social justice. So, in my opinion, it's impossible to separate the two. And when we look at health disparities and health justice, it's a core public health issue. So not only do people deserve access, knowledge, equitable services, care, but they also deserve to receive care that is free of discrimination and stigma. And I know we'll dive more into this as we chat, but for me, you just can't separate public health and social justice. And I've been an advocate for a long time, and for me, that's just a core component of the work we do.
Yeah, well, thank you for sharing that. So you began your collegiate career in a Bachelor's of History in Genocide Studies and International Relations from Manhattan College. So what was your thought process for getting this degree?
Yeah, so I wasn't naive, but the only subject in high school that I actually enjoyed was history. I've always loved history. I'm not sure why. I grew up on a farm in rural New York, but I just have always loved history, particularly modern history, 20th century. There was a time, actually, when I went to college that I thought I was going to get my PhD in German history. Obviously, that did not happen. But I also minored in Holocaust and genocide studies. And the more interested I became in human rights, which was a direct result of studying the Holocaust and genocide, eventually led me to public health. So, long story short, I finished my history degree and took a lot of courses in international relations as time went on. And I had already started working on a master's degree in education. So I was a part of a dual degree honor program. So it allowed me to start taking courses, master level courses in undergrad. So when I figured out that I didn't really want this PhD in German history, and I didn't necessarily want to teach in the meantime while I was working on that PhD.
So you got your bachelor's of history, and throughout that process, you went into your master's of education. What was that thought process like for you?
Yeah. So, at a time when I applied to be in this dual degree honors program to get my master's in 1 year and start working on my master's as an undergrad, I thought that I would teach while I worked on my advanced degrees. And that made complete sense at the time. But I I knew that I didn't necessarily want to teach, and that my BA in history was enough for me. Didn't know exactly where I wanted to go. Um, but in between finishing my BA and that final year of my master's, I actually went to Tanzania for the first time, went to Africa for the first time, and did a short HIV education program that I don't want to go into this too much, but if I look back on it, I discourage people from doing those types of programs now because they're so short and you don't really get to know the community. I learned a lot though from that process. And when I came back and finished my master's in education, I applied for the Peace Corps. So as you can imagine, when you're studying the Holocaust and genocide, my class discussions were obviously always around, how do these atrocities happen? And I really grew tired of that question and wanted to focus more on solutions. And that's why I joined the Peace Corps. So.
Okay, that is quite fascinating, and it is interesting to think about think about like just studying history in general is kind of it's not really, you're not doing anything actively doing anything, you're more so just sitting back and just reading and researching and looking and seeing what's happening, as opposed to public health, which is seeing what is happening and how can I engage the community and really try to push the work forward. So that is fascinating. How did the dual degree work out? Did you have to like finish 4 years of undergrad and then do 2 more years for your master's, or did 1 year, or what was that process?
Yeah, it was, in that sense, it was great. So I did the 4 years, but starting my senior year of my undergrad, I took almost all master level courses. So they counted towards both degrees. So essentially, I was doing like 3 years of my regular degree and then 2 years of master level courses. And then I had to take, there was one summer that I had to take a few courses. So, yeah, I got 2 degrees in 5 years. I won. No, I'm just kidding. I'm still paying for them. Don't you worry.
Yeah, but that is awesome, and I almost went to Manhattanville College. Fun fact, yeah.
No
But
way.
yeah, I was really close to going to that school.
Oh my gosh,
Yeah, for
that's
undergrad.
so great.
Yeah, but I thought it was very interesting, something that you said earlier about like going to Tanzania and how you weren't really, you felt like you were just there for a short period of time and you're not really engaging with the community, and I feel like that has definitely shaped how you move forward with your work. So do you want to just touch a little bit more on why you would advise people to rather go for longer periods of time to try to take part in like more deeply entrenched community work?
Yeah, I think especially these volunteer programs that are making money off of volunteerism. I think of Taylor, a lot of us follow her on Instagram, and she's very passionate about this, rightly so. I think we go in with good intentions, we think we're going to help, but it's, who am I as a white woman to go in to a community for 6 weeks and teach people about HIV and AIDS? I don't know that community. It's just, I think it's it's not right. And again, those organizations, a lot of these volunteer organizations are making so much money off of these volunteers, and it's just not ethical. So yeah, I definitely look back on that. I mean, not to be fair, I bad Christie, but I think you know, at the time that I did this, it was 2001. So there weren't people like Taylor out there talking about how the negative effects of this. There really weren't. But I have learned over time and discouraged people from going for these very short volunteer stints or even missionary work. It's like really think it through and what good am I doing? And are there other ways that I can support the work that's going on in other countries? And if you enjoy traveling, great, travel responsibly. But this shouldn't be a vacation to go and teach people about things. Especially at the time, it was 2001. I didn't have the credentials. I wasn't a public health professional then. So that's another important piece.
Yeah, and yeah, Taylor does have like a couple posts on that, so definitely check that out. I will link it in the bio, well, the bio in the show notes. And yeah, thanks for sharing that. And I think it comes with education, you know. And I feel like just culture in generally has gone to more like PC things. Like we didn't really think about these things in holistic ways, and just maturation of culture, I guess, as we go along. So when you finished your Masters of Education, were you like aware of public health at this time, or were you not aware of public health?
No, that's a great question. Not really. No. I'll talk about the Peace Corps a little bit now because that's really what brought me into public health, even though when I finished my master's, I had applied for the Peace Corps and I got accepted, which is awesome. It's actually quite competitive. And I left in 2004 to serve in South Africa. So Peace Corps is typically 2 years. You can leave whenever you want, but I made it the 2 years. Yay, Christie. And I lived in rural South Africa. And I worked on HIV and AIDS education. So there's a huge difference between the Peace Corps and what I did in Tanzania. The Peace Corps is not perfect. Lots of people have negative experiences, but my experience was not negative. The first huge difference is most Peace Corps volunteers, including myself, have 3 months of intensive training. So it's not just, you know, training about HIV. It's like we had training on how to behave at funerals, how cultural training, language training for 3 months. And during those 3 months, you also live with a family. So you really are, you know, just even from the get-go, you're thrown into the community and you live with a family, and we spend 8 hours a day in training and language and learning all of these things. So that from the start is a complete, 3 months in training versus 6 weeks just, you know, going out and talking to people about HIV. So there's one difference. The 2 years of service actually starts after those 3 months. So I went to my village, which was in rural South Africa on the border of Swaziland. And it's honestly really, I'm going to be honest. I wrote a blog, maybe you can put that in your show notes too, about this experience and how it led me into public health. It's hard for me to talk about the experience because it was 2 years. It was a lot of highs and a lot of lows. But I lived from a public health perspective. I left in 2004, and at this time in South Africa, the region that I lived in had the highest rates of HIV in the entire world. An estimated 1 in 3 people were living with HIV. And that really defined my Peace Corps experience. I talk about this in the blog, but there's a book called Saturdays Are for Funerals. And my Saturdays were for funerals. So in the beginning, the first year that I was there, it's really about getting to know your community, just sitting and listening and earning trust and learning the language. And in the beginning, I would go to funerals because I wanted to support my community. I lived with a family. I wanted to support my family. And year 2 of the Peace Corps was really about, you know, doing the work, but also it became more about supporting my community, but it was also, I started going to funerals for people that I actually knew. And it was, yeah, it was a challenge. I talk about it in the blog. And just a high note here, when I first left South Africa, I called my family a couple of times, and it was very challenging for me because I continued to lose people, but I wasn't there to grieve with them. And no one really understood what I was experiencing, if that makes sense. So I lost touch with them. And literally less than a month ago, I found my sister on Facebook. And I've been reconnected with a number of people that I worked with. And I can't tell you how rewarding it is. My sister is a nurse. My other sister is a community health worker. One of the guys that I worked with at a nonprofit on HIV prevention, he is now he works in environmental health. I just like, all of them work in health. It's like, it's so exciting to me, and they're all doing well. And, you know, that I get chills when I say that, because my sister, one of the first things she said to me, you know, she called me through Facebook. It was just the most exciting reunion ever. But, you know, after talking to her for a bit, she's like, most of the people that you knew aren't here. They've all passed away. And that's why I stopped calling. That's why I lost touch with them. But at the same time, it's really comforting to know that those that I was closest to are doing well and working in health. So, yeah.
Yeah, well, thank you so much for sharing that. I'm sorry for your losses there, and that's really nice that we have the technology and the capabilities to reconnect with people and have those conversations. So I'm really glad to hear that.
And also, just a quick plug. I think it's amazing that this podcast is going to be released on World AIDS Day. So it's really connecting my past to my present. So thank you, and just want to take a moment to just remember all of those who have been not only lost, but those who continue to be affected. It's challenging.
Yeah, thank you. I appreciate that. And yeah, it'll be released on World AIDS Day. So happy World AIDS Day, everyone. Let's go out and advocate and support communities and people that need us. So did you really were you thinking you wanted to go like abroad and then Peace Corps was kind of like the way to do that? Or were you like, okay, I want to work for the Peace Corps, and then this was the opportunity?
Well, I think so. My aunt and uncle met and married in the Peace Corps so I grew up in a Peace Corps family.
Okay.
And I studied abroad a couple of times during undergrad. Again, I'm still paying for this. Student loans. But it was worth it. I mean, those types of experiences really shaped who I became at this time in my life. So yes, I wanted to be abroad, and I wanted the experience, and I wanted to, as I said, you know, when I studied the Holocaust and genocide as an undergraduate, it really shifted the way that I thought about things. When you sit in classes and just this consistent question is being asked, like, you know, why didn't people do anything differently? It's like, why aren't we doing anything differently now? There are mass atrocities everywhere in the world. So it really became about what is my role and figuring that out. And for me, the next step was the Peace Corps.
Yeah, okay, that sounds good. So you did your 2 years of the Peace Corps, and then you came back to the States, and you started a role as a reproductive health educator at Planned Parenthood of Rochester, Syracuse region. So how did you go about looking for this role and getting this role?
Yeah, good question. I have to be honest. When I came back from the Peace Corps, I was a hot mess. You know, I had lived abroad for over 2 years, and then I traveled after the Peace Corps. So I literally had not set foot in America in 2.5 years. Not once. So I had reverse culture shock. It was hard because people didn't understand what I had experienced. And it took me some time to find a job because I was in rural New York. But I was looking for jobs in New York City and Boston and Chicago. I would have gone anywhere. I just wanted a job in public health. And I was actually at the gym one day. I was living with my grandmother at the time. My grandma, shout out to grandma. And I ran into somebody and they're like, Christie, there's this reproductive health job here. And I was like, here, I don't want to stay here. I did not want to stay in upstate New York. I love where I'm from. I love visiting my family, but I wanted to move. I hadn't considered staying put, and I had an interview and I got the job and I was like, okay, this is where I'm meant to be right now. And boy, it was, I love that job. To this day, being a reproductive health educator was my favorite job of all time. I loved it. I learned so much about sex ed. I learned so much about comprehensive sex ed in schools, universities. Also, working at Planned Parenthood, you learn a lot of, teaching and education tools, dealing with challenging topics and how to handle those in situations. Obviously, so much of what we did was prevention, but abortion came up a lot, and handling those complicated conversations taught me a lot at a very young age, as far as facilitation and handling complicated conversations. And I ended up leaving because I wanted my master's in public health, and I wanted to do more in the field, and didn't feel like having a master's in education was enough. So I didn't feel like that the experiences of Peace Corps and working at Planned Parenthood were enough to move me forward in the field of public health. I think I could have stayed where I was, but I wanted to do more.
Okay. And how did you come to know about the Masters of Public Health? Was this earlier or during your time at Planned Parenthood?
I think Peace Corps volunteers have a bit of a reputation for going into public health.
Okay.
So, yeah, no, I definitely started thinking about it is when I was in the Peace Corps. But I wasn't ready when I got back. I didn't want to jump right into a master's program. I wanted more experience, and I just wanted to work for a little while because I really hadn't done that yet. So, yeah.
After Planned Parenthood, you went on to get your Masters of Public Health at Monash University. So why did you want to go? Because this is in Australia. Why did you want to get a degree, an MPH degree from a foreign place?
Yeah, this is such a great question. And obviously it's a very common question that I get when people find out where I got my MPH. So there's a couple reasons, but the primary reason, and I'm just going to be straightforward, was the cost related to getting a master's degree here. My number one choice, and I got in and I was excited, but when I really looked at it, it just wasn't feasible for me. I wanted to go to Emory. I loved Emory's program, but again, it just didn't, I had already put myself through two degrees, and I put myself through college. I didn't have support from my parents. So the amount of debt that I would have had would have been astronomical. So I started looking at programs all over the world, not just Australia. But I found this program in particular, and it was an international health program, strong ethics and human rights department, which were very important to me. As I've already talked about, that's essentially what got me into public health is human rights. So it just felt like this really great fit. And I mean, I think people would be shocked to know that my master's, including flights, living, tuition, cost me probably less than $40,000. And I had the experience of living in another country, of learning from other people, And one of the great other, I loved the program that I was in, but another benefit of the program that I was in is they would have for specific topics, like my refugee studies, my refugee health course, and my nutrition course, my public health nutrition course. Not only were they taught by leading experts in the field, but they would do these 1 week intensives so that people that were working at refugee camps would actually come in for these intensives. So I had not only the best professors, but I also had people that were working on the ground there in our courses. And it's just incredible the amount that you learn from other people. We all know that, right? So I, I always just was in awe of some of the people that I was with in these courses, doctors, people working on the front lines, organizing refugee camps. I mean, it was incredible. And just a fun story that I love to tell is during an interview for an internship, I was asked the question, why Australia? And my a woman who became my mentor, I told her, I was like, for all the reasons that I've just explained. And I told her, she's like, where were you going to go if you stayed in the States? And I told her Emory, and she's like, you're kidding me. And I'm like, no, why? She's like, the head of your department was at the CDC for 15 years and he used to teach Emory. And I was like, you've got to be kidding me. So like, it felt validating because even to me, it's like, am I really going to go to Australia to get my master's degree? But then when I find out that the head of my department lived in the States, taught at Emory, it felt just, I don't know, it was exciting for me. It was an exciting moment that kind of brought the whole decision process full circle and made me feel like I made the right call.
Yeah, and that is awesome. I'm glad that you got to have that conversation and that she sold you on, oh, this guy, he was in Atlanta, he was at Emory,
right?
he worked for the CDC, and he has all that wealth of knowledge, plus more of coming to Australia and like transitioning both of those two worlds and everything in between.
Yeah.
But that's really awesome. So was your concentration international health?
Yes.
Yeah.
So little side note, while I was working in reproductive health, while I was an educator, I met my husband. My now husband that I'm still married to. And we tried to break up and that didn't happen. So that's why I've done some work in international work, but after my master's degree, my work really became more about health education, health literacy, just as a side note. Yeah.
Yeah, fair enough. Thank you for that side note.
Yeah.
So while you were in Australia, you had a job at Monash as a research assistant. So what kind of work did you do in this position?
Ooh, this. So I worked, and I say ooh because I learned so much from this internship and research assistant position that I had. I worked on a sex worker toolkit, and I also worked on a brochure of sorts, an educational pamphlet for sex workers to educate them on their human rights. So it was honestly one of the most eye-opening opportunities that I've ever had. I had never thought about really sex work other than what I knew of it from the little bit I had read online, and it just opened my eyes to so many things. I so I'm trying to think of the best way to kind of summarize. Again, I didn't know anything about this topic before I entered graduate school. And by the end of my master's, some of my fellow classmates actually joked that I got my master's in sex worker rights and public health because I just focused on it so much, and it became another passion of mine. When I was asked to write this education pamphlet to educate sex workers about their human rights, I sent the draft to my mentor, and the same woman that told me about Emory, and she was obviously very in close proximity to me when I sent this to her. So she walks out of her office and she sets down this book. It's a children's book called Health is a Human Right. And she's like, this is what we need. Like it was my first direct lesson about health literacy. Like, this is the level that we need to be talking to sex workers. Some of them might not have had more than, grade school. They wanted it to be very simple, so much so that it could be easily translated into other languages. And it was, like I said, I think it was my first direct lesson about health literacy. And so I learned a lot about human rights. I learned a lot about sex worker rights, and the connection to public health. So obviously we know like sex workers are more at risk for STI infection, violence, harassment from the police, stigmatization, and I could go on and on. And of course, all of these things put them at higher risk for HIV and violence, infections, abuses in many other ways. So really, again, it just opened my perspectives of the world and how I saw rights, and really, yeah, it was an incredible experience.
Okay. Yeah, thank you for sharing that. And then after your master's in public health, you went on to work at the National Hemophilia Foundation. I'm guessing this is the U.S. National Hemophilia
Yes, I came
Foundation.
back.
Okay.
So yeah, I came back, and there was a brief. So when I first came back, this is when I married my husband. So I came back. He actually came to Australia. I know this is still a fun story, right? My husband came to Australia and proposed to me. And then I finished my master's and came back to Western New York. So I worked for and it's not even really worth mentioning, but I worked for an AIDS organization for just about a year. But then during that year, I was really looking to move closer to New York City. And that's when I started working for the National Hemophilia Foundation. Yeah.
Okay. Now, what did you do in this role?
Oh, I love this job too. So this job is really a perfect combination of my experience in education and public health. I loved this job. So I did a number of things. I oversaw a national youth program for those who had bleeding disorders. I also worked with chapters and affiliates across the country to provide programming. But the best part of this position for me personally was I had the opportunity to develop an entire training manual to improve chronic disease management. So I wrote the manual the first year. It's huge. I typically keep it close to me, but I don't have it right here. And then the second year, I created and facilitated a train the trainer to implement this content across the country. So, and I would say until How to Talk to Your Doctor, this is probably my proudest professional achievement. And I think a lot of public health people can probably relate to this. I got to see a project from start to finish. And I feel like that's rare these days with all the bureaucracy and, people coming in and out. And it was just such an incredible opportunity to everything from the research on the front end, interviews, focus groups, all the way through seeing it, implemented as a train the trainer and educating the community that would then implement it. It was incredible.
Yeah, that truly is awesome. What do you think prepared you to take on the task of like writing out this entire manual and then being able to train people to actually use it throughout the country?
I think this is where I was so grateful that I finished my master's in education. Like I had been training and creating materials. So I created a lot of materials during graduate school for sex workers. And I had created materials as a reproductive health educator. And I did a lot of training in my first, during the Peace Corps and as a health educator as well. And this just blended everything. This just brought it all together for me. And that's why I loved it so much. And just, yeah, it was, like I said, I typically, the manual is like my personal Bible. I, I typically have it like right next to me. I'm like, I'm so proud of this. It was incredible. And I love facilitating. So it was just, yeah, I'm very lucky to have a project from start to finish like that.
Yeah, okay. And what tips would you give someone if they wanted to be a better facilitator?
Ooh, it's a good question. I think a lot of, when it comes to facilitation, I think a lot of it comes from, you can learn some methods that will certainly help you, but I think a lot of it is practice. So you learn the methods, but you have to practice. You also have to prepare. I think any, seasoned facilitator is going to tell you that most people don't realize how much time we spend preparing for whatever it is we're facilitating. And preparation is just so key. And it also comes down, when I talk about preparations, also, trying to think through how people are going to respond to things and knowing how you might react to that. And this is one thing I learned during, my time at Planned Parenthood. Really, learning how, if I'm talking about X, Y, or Z that could be controversial, how am I going to handle it if somebody's in the room that doesn't necessarily want to hear it or believe it or whatever it is. But really thinking through your audience and how they might respond to things, whether it's controversial or not, that should be done.
Yeah, thank you. I think that's very solid advice right there.
Thanks.
Yeah, thank you. Then after that position, you moved on to a role in maternal and infant health. So what was this role?
This role.
Yeah.
So this role, I am not going to talk about for too long, but I do want to mention, I think a lot of people can relate to what I'm going to say right now. I loved the job. I love it on paper. It was my primary task in this role was to spearhead and lead a community coalition to improve maternal and infant health outcomes. I also supervised community health workers, created the work plan. It was on paper, it was Christie's dream job. I was working with women's health, prevention, all of these things that I love, facilitation. But the work environment was one of the most toxic places and experiences I've ever had in my life. So much so that by the end, I was clinically depressed and needed to walk away. I didn't have anything lined up. I just couldn't take it anymore. And I was working for a federally qualified health center. And I know that so many people are in similar positions, and it's just challenging. It's really challenging when we find ourselves in toxic work environments and knowing what to do in those situations. But for me, it was time to walk away. So I did. And this is fun story because it leads me right into how I started consulting. I didn't have anything lined up, but within 2 weeks, and I'm not joking, I'm not exaggerating, the Hemophilia Federation of America reached out to me to ask me to, quote unquote, like clean up some of their programs. They wanted kind of the instructional design piece. They wanted me to make them more interactive. They wanted facilitation guides to complement them so that the speakers could, have a guide when they were presenting on these topics. It was just incredible to me that I took a chance and walked away. And I am privileged. I have my husband, he has our insurance. So I'm very privileged. And I don't want to continue this conversation without saying that I was in a place where I could walk away. But to take that leap is not easy for me. And I think it's not easy for a lot of us because we feel like we've failed. But we didn't fail. Whoever we're working for failed us. And I just want to say that because I think it's really important for us not to blame ourselves. And that's something that's taken a lot of therapy for me to say. Like I've had to work on overcoming that, because I thought it was like me as a failure. I didn't do the right things. I didn't say the right things, but it really wasn't about me. It was just the situation that I was in. But again, back to the positive, it's what brought me into consulting. The Hemophilia Federation of America. So this isn't the same. There are two national hemophilia foundations. Mm-hmm. The one that I just told you about, that I wrote the training manual for and did the train the trainer, that is the one based in New York City. This is the one based in Washington, D.C. So they brought me on, and I thought it was going to be like a few months, but at least it got me going, mm-hmm. And it ended up being over 3 years that they kept me on. So you never know with consulting, you really don't. And I did a lot of work with them. It started out, like I mentioned, cleaning up their programs, but then it turned into so much more. I oversaw a national working group to address the opioid epidemic and pain management, because a lot of people with hemophilia live with chronic pain. I created new content, new programs for them. I helped them coordinate sessions for their national meeting. It turned into almost a gift. So I'm not telling everybody to walk away from a job if they don't have something, sustainable, but I did it and it worked out. And look at me now, I'm still consulting, and it almost feels like a blessing in disguise.
Yeah, absolutely. That is awesome, and that's amazing that you were able to get that contract and then keep it for 3 years.
I know.
that's
and
amazing.
I still do work with them. So it's not as intense, or it's not as involved, I should say, as it was before. But yeah, I still do workshops for them and facilitation of some of their groups. Okay. So it's still a great relationship.
Yeah, awesome. And then also I want to say power to you for leaving that toxic job. So definitely lots of power to you there. So what was the process like for you, since you didn't really think about consulting, but it kind of came up to you? Like, how did you go about setting up like the business side of the consulting?
Yeah, that's a really great question. So Omari, for the first 3 years, I didn't. I was just like a solo entrepreneur. Like, I didn't have CVH Consulting proper at that time, because I didn't feel like I needed it yet. I wish that I had started the process of becoming an LLC a little bit earlier on than I did. I will say that. But as I'll say a couple more times before we end this, I think when you start a business or you start consulting, don't be hard on yourself. It is, it's just a learning curve. There's such a learning curve to it. Owning a business is not easy. So I do wish that I started that process a little bit earlier. So CVH Consulting is probably about 2.5 now. Okay. But I've been consulting for over 5 years. So when I started, it's the basics, getting the LLC, making sure you have insurance for your company, website. It's a lot. But it's empowering when you get through it all. It's kind of like, there's really nothing that I can't do at this point in my life. I really mean that. Like, when I come across like challenges now, it's like, I learned how to start a business by myself. So like, when you come out on the other side of it, it's like, wow, it's really exciting and empowering. But that's why my message is, if you're thinking about doing this, just don't be hard on yourself, because there's so much to learn. There's a learning curve.
Yeah, absolutely. So what services do you offer, or like, did you offer just that one like facilitation and helping them build out their manuals to support other work, and then get other other clients and then build out your work from there? Or did you like build out your work and then get clients?
Yeah, no, that's a great question. So when I was working with them, I had a couple of other small clients that just knew me and asked me to do some work for them. I think that this is one of the key things of consulting is, you have to find jobs from different places, RFPs, word of mouth, referrals. But I didn't work hard at finding other work because I had my plate was full. So I didn't need the other work at that time. Again, this is why I wish I started CVH before, because it was unfortunate when Hemophilia Federation let me go. They lost a significant amount of funding from the CDC. So that's when they had to let me go. And I was kind of, oh shoot, like, what am I going to do now? And it took a tiny bit of time, but I got back on my feet, and I've worked on some exciting projects. I think when I talk about the services that I provide, it's sometimes easier for me to just describe some of the projects that I've worked on. Is that okay if I?
Yeah, please do.
One of my favorite projects that I worked on this year was with the National Environmental Health Association. They brought me into a project that they were working on with the Department of Health in the Virgin Islands for hurricane prevention. So I developed and facilitated role plays to provide that skills-based practice for the Department of Health there. So they knew how to handle the press, so that they could have community conversations to prepare people for hurricanes. It was just such a rewarding project. And of course it was before COVID. This was in January when things were still happy and joyful. But yeah, it was a very rewarding project. A couple of other things I've done. I worked on a project with Temple University to create a 3-part educational series on opioid use and prevention for professionals. My local United Way, I've facilitated conversations and meetings for them around food security locally, and how to action plan and think through, how to lead multiple stakeholders to align their resources and design the necessary actions that people will take, and responsibilities that different organizations will take. And then more recently, I've been working on multiple sclerosis projects, which I've really enjoyed. And this is the one thing about consulting. It's one of my favorite things is all the people that I get to work with, and all the different organizations and all the different topics that I get to learn about. So this year, I've just named opioid use, multiple sclerosis, hurricane relief. It's just incredible. That is one of my favorite things about being a consultant is just all the different things that you're consistently learning.
Yeah, awesome. If you had to start over consulting and do one thing different, what would that be?
Ooh, that's a good question. I think I'm going to answer this in 2 parts. I think personally for me, I would have founded my actual consulting business before I did. I think in general, if I was going to give somebody advice, it would be to do, research before you start. So understand how to start the LLC, get a good accountant, get a good lawyer. And yes, those 2 things cost money, but everyone will tell you in the long run, they save you money because you've got to do it right. So get a good lawyer, talk to other public health professionals. I highly recommend Leah Roman's course. And I would also recommend following Dr. Huntley. So those would be my top advice. That would be my top advice for other folks. For me, I wish I had founded my organization sooner than I did. I was still a consultant, but I think when you're out there, and this is a piece of advice as well, when you're out there trying to sell services, having an LLC and having a legitimate website means a lot. You have to be legitimate. And I didn't have that when I started because I got jobs here and there. You'll see I'm kind of in the middle phase. I hope someday that I know one consultant, she's a very dear friend of mine. She doesn't need a website because she's so much work.
Mhm.
So I'm kind of in that middle phase, but when you're starting out, you need it. You need it.
After CVH Consulting had been starting, you also founded How to Talk to Your Doctor as a sister project for CVH. So what is How to Talk to a Doctor? To
Yes.
your doctor, sorry.
No, yeah, you said it. No, so How to Talk to Your Doctor is my passion project, which um I was creating a portfolio piece for my instructional design work. And as I was creating it, people were like, no, like we need this. Like it shouldn't just sit somewhere as like, this is what I can do. I can create curriculum. I can, you know, it, so it it turned into a project. And late last year, I was having a conversation with a friend, and she said, have you thought about separating the consulting from how to like these workshops? So, as of probably a year ago at this point, I had these workshops under CVH Consulting. The workshops really focus on health literacy and improving the patient and provider relationship and communication skills for both patients and healthcare professionals and parents. So I have a number of different workshops that people can choose from. And I had this under my consulting, but when you really think about it, these workshops are not consulting. People aren't hiring me to solve a problem or to help them to improve something. So I came to this conclusion that I really needed to separate it. Mm-hmm. And looked for the domain. I started looking for domains, and howtotalktoyourdoctor.com was available. And not only was it available, it was $14. So if that doesn't tell us that there's a problem, I don't know what does. And I talk to people all the time that, yeah, just, and I tell them this story, and they're like, the same response you just had, shaking their heads. It's like, this is crazy. So yeah, that's how it started is, and then I created just the overview. I can send people to I'd love to send people to my Instagram and then my website if you don't mind putting it in the show notes. But yeah, so it's growing, and I'll share a little bit more. Do you have any follow-up questions?
Yeah, like if someone wanted to get involved or reach out to How to Talk to Your Doctor, how would they connect with you and on that project?
So two very easy ways: howtotalktoyourdoctor.com and at How to Talk to Your Doctor on Instagram. I Yeah, it's if you go to my website, you can see a list of the workshops that I have for patients, for parents, and for healthcare professionals. I There's such a gap in communication when we educate folks. There really is. And I think there's also this stigma around the fact that, well, shouldn't we just be working on the healthcare professionals, like doctors, talking to patients? Absolutely. I'm not saying that. Absolutely. 120% that needs to be happening. But we aren't going to see these deep system changes for a long time. And I think we have no problem. This is kind of the example that I typically use. We have no problem, and we want to give people the information about, say, diabetes or HIV or reproductive health or even MS. I'm doing some really great MS work right now. So they have the information about their condition, right? But how far can we go with that information if they go to the doctor and the doctor prescribes a medication and they're fearful to simply ask, I don't understand, or can you explain to me how to take this properly? I mean, that seems like something that's so simple, but people really do fear asking these questions. So how do we break down those barriers? How do we help people to feel more prepared so that they feel more comfortable looking for a new doctor or asking these questions that I've just mentioned? And I also help professionals work with the folks that they work with to have those conversations. So kind of just taking it a little bit further. If I'm talking to you about diabetes prevention, what are some ways that I can help you or my, whoever I'm working with, think about, okay, how can I prepare for my next doctor's appointment, to make sure that my doctor hears me, and then moving that conversation forward. And it's not easy. It takes time, but I really do believe in the work that I do, and I hope that it will, even if it changes one life. I really believe, but I think it's going to do more than that.
Yeah, I absolutely think so too. And I think that is a very important topic that isn't spoken about enough. Just how much like mistrust or just like not having the confidence to ask those questions, or just saying, oh, their time is too important. I don't have the time to ask those questions. So I applaud you for this kind of work, because it is important. And just you doing this is going to make more people aware of it. And then hopefully that ripples out and we continue to have these better conversations. So how do these workshops work exactly? Is it just you go to a workshop and it's providers only? Or is it a workshop with providers and I guess patients or consumers of healthcare? Or how does that work out?
It's great question. So two ways. I've had people write me into grants to do healthcare professional trainings. They're separate. So I don't offer professional trainings with patients. They're separate. So I have trainings and workshops for patients specifically, and then I have workshops specifically for professionals. Mm-hmm. They look a little bit different. Until COVID, I was traveling a lot. I had a lot of people sponsoring me, bringing me out to conferences, doing workshops at conferences, primarily for the patient population. When COVID hit, it really, I'm not going to lie, I was devastated. It was taking off so quickly, and it felt like, I don't know, like my world was coming to an end. And I know that that's ridiculous. There's so many people going through so many other things, but when you're building a business and you just are so excited about it, and literally overnight it's taken from you. I know that so many people have dealt with worse and similar things. So I know there's a lot of people listening that will relate to this. But on a positive, and this became a positive for me, is I think that because I had so many in-person trainings, I wouldn't have taken the leap to offer them virtually. It was always a goal to be virtual, but I wouldn't have done it as soon as I have. So now all of the workshops are available online. It looks a little bit different, but I still have found a way to incorporate group work, discussion, even some role-playing scenario work. So I've really stayed true to what I offer, even in a virtual world. And I'm excited. Actually, you are the first to know that I will be releasing an online course about women's health, and exactly what you were just saying about not being trusted, and just all the underrepresentation in women's health. Mm-hmm. Obviously also be talking about racial disparities in that. This will be for healthcare professionals, and it will be released early next year.
Okay, awesome. Yeah, well, thank you for sharing that. So what has been your biggest lesson from like having this thing that you wanted in person, just like, I guess, destroyed in a sense, and having to shift it to online?
What was the start of that question, Omar?
So like what was the lesson?
My lesson.
Yeah, or something that you learned.
So it honestly, my lesson was not to fear failure. I have always feared failure. It's why I stayed in that position, the maternal infant health job, for as long as I did. And I was only there for a year, but really I knew that I was in a toxic environment within months, and I feared failure. And when COVID hit, I was devastated. I feared this failure. Like, I just launched this, and have I failed? What am I going to do? I can't do my in-person trainings anymore. And it was a challenge, but we learn, and I feel like there's more of this since COVID hit. And I think that that's a great thing. I think that we are, this hopelessness that a lot of us have felt this year in some way, in some form. We're all different, but everyone's experienced it this year. And I think that it has really taught me a lot, and that we learn from this, that we grow from it. And it might not be right now. It might not be, it took me a couple months to overcome that. It wasn't like I woke up the next day and was like, oh, it's okay, I'm just going to go virtual. No, it was a process for me. I was depressed. It was hard. But now I wish I could have seen myself then. Now I don't mind the virtual. I have so many exciting things coming up in the new year. Not only am I launching this course, and there will be more courses, but I'm also co-hosting a podcast starting in January. So it's really exciting. And it wasn't easy for a couple of months, but now that I'm on the other side of it, I think it's just remembering that failures can lead to better days and learning.
Yeah, absolutely. Thank you for sharing that. I appreciate that. So at the beginning of the interview, we spoke a little bit about your book club. So I just wanted to, I just wanted to give you back your time to talk about book club, because I saw it on Instagram today somewhere.
Yes, I love book club. Actually, Leonore from Public Health Culture, she is the one who originally started this, but she has a lot on her plate right now. So I just want to give her a special shout out. I'm just kind of carrying the torch for her. Well, she's got a lot going on. So we're going to have, our next book club is going to be in January, but it's a public health book club. So it's open to everyone. I do try and cap it at like 10 people, just so that we can have more in-depth conversation. But everyone we've had so far has been unbelievably just wonderful. It's just great to talk to our other public health colleagues. And for those of us who aren't in school anymore, I think we miss that academic environment where we can have conversations and talk about public health. You're smiling. It's so true, right? Like, we miss it, crave that. So it's been wonderful. And we've talked about a lot of challenging topics. We've talked about a book called Just Medicine. A lawyer wrote it, and it's about bias in healthcare, but from a legal perspective. She's a lawyer. So that was very, very interesting. Dying of Whiteness, which looks at why white people literally vote against themselves when it comes to gun control, healthcare, education. So yeah, we've taken on some, challenging topics, but it's just been super rewarding.
Yeah, awesome. So yeah, definitely everyone go and check out the book club and try to get in there before it gets lock and loaded with people. I know that I'm definitely going to try to get into the book club. Yeah, because I like reading books and I don't get to discuss the books I read.
Oh my gosh, we would love to have you. That would be awesome. Fantastic.
Yeah, definitely. Let's do it then. Awesome. So before we move on to the last section of the show, I would just like to ask, where would you like to see yourself in the future?
Honestly, when I think about this question, I think, like, where do I see myself in 5 years? I really hope I make a transition from consulting to doing and focusing on how to talk to your doctor full time. As I've already, it's less than a year old, which I can't believe. It feels like I've had it much longer. But I want to create more workshops. I want to have more specific disease focused or women's health focused workshops, such as, talking about the podcast I'm going to be hosting is all about periods. So this is just one example. I would love to offer more resources for people about specific like OBGYN visits. How do I talk to my OBGYN? Or if I have a chronic condition and I need to talk to a neurologist about MS. So over time, I want to add to the offerings that I have, and also grow the training and workshops that I have for healthcare professionals as well. The dream in 5 years, I'd also love to see an app. I am consistently approached on LinkedIn by all these tech people that want to turn how to talk to your doctor into an app. And I am like, if you want to fund me, I would love it. So if anybody sees grants for apps, health-related apps, I would love to apply for those. But yeah, I think I'll always consult on the side, but it'll be exciting because I could like pick and choose what I want to do. Because I, as I mentioned before, I love consulting. I love learning about the different diseases that I get to focus on and meeting different people all of the time. It's incredible. So yeah.
Yeah, absolutely. That is awesome.
Are you going to have me back on in 5 years? Because that would be cool.
Yeah, I will. I will have you back on in 5 years, and we'll see just how good that app is.
Yes.
It'll probably become like a PS4 game by then.
I love it.
Awesome. So moving on to the last section of the show, the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
So just a couple things. Network, take internships that interest you, find your niche. I think that's a hard one for a lot of students. And then my last little bit of advice is listen to podcasts like yours and Dr. Huntley's. You both have so much to offer, and listening to different professionals through your interviews helps, I think, a lot, as far as defining where we want to go.
Thank you. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
I mean, I think I've touched on this a lot, but just to summarize, starting a business is challenging, but don't fear failure. And it's as challenging as it can be at times. On the other side, it's equally as rewarding. And just start researching and grow from there.
Awesome. Number 3, what's something you're working on improving in your life right now?
COVID has definitely taught me to be more patient with life in general. I think that setback that I just talked about, it's like, it's okay. And it's okay that I had a few bad months where I honestly didn't get much done. I think I am trying to spend more time on myself and my family. And I mean, before I was traveling all the time. I don't have kids, so, it's not that, but it's just taking more time for myself and making sure that I do it. When you're a business owner, it can be 24/7 because there's nobody to tell you to stop. There's no paid time off. It's establishing boundaries is very important. Maybe that's also another tip that I give, is establish boundaries for yourself. So make sure that you take care of yourself. And then professionally, I'm going to be co-hosting a new podcast. And then I'm so excited about that. And then also the online courses. So that's new to me. I've done a lot of instructional design, but the online courses are going to be new, and I'm excited about that. So
okay. Yeah, awesome. Number 4, professionally, you recommend anything. Well, I know you recommended a bunch of things during this episode, and I hope to link to all of them in the show notes. But is there anything else that you'd like to add to this list?
Well, let me see. There are a couple of books that I absolutely loved this year that I did not mention before. Untamed, Glennon Doyle. That is a book. Well, you should read it too, but every woman should read that book. And then I'm Still Here by Austin Channing Brown. It's her memoir. It's actually a very short book, but I read it in one sitting, and it's an incredible book. And then I know you have podcasts. My two favorite podcasts are America Dissected. Do you listen to that? I love that podcast so much. And then Code Switch. Especially for all my white friends out there. Code Switch is like, they just talk about everything under the sun, and it's just such an incredible learning journey that you go on with them.
Okay, awesome. I got some books and some podcasts to add to my list. So last but not least, where can people connect with you?
So I'm going to make it super easy. I would love for people to connect on How to Talk to Your Doctor. So on Instagram, it's just at How to Talk to Your Doctor. And then also my public health, what do you call it?
Handle.
Mm-hmm. Thanks, Omari.
No problem.
It's Christie _public health. And then on LinkedIn, you can find me just Christie VanHorne.
Okay.
So those are the best places to connect with me.
Okay, awesome. Thank you so much. Well, I appreciate you taking your time to be on the show. I know that you gave so many different resources and books and great information. So I'm really happy that I got to have you on the show today.
Thank you. It was a joy. I don't think I've ever talked about my journey in the way that I did with you. So thank you for having me.
Yeah, my pleasure. And I'm just glad that I get to capture your story and share it with the world. So thanks for being so transparent and open.
Yeah, of course. Thank you so much.
Well, I am absolutely glad that I got to have Christie on today. She definitely has had a great journey and shared some really personal as well as some very informative information for public health people interested in public health. So I definitely hope that you all take notes of the books that were in this and go and follow at How to Talk to Your Doctor. And yeah, I appreciate all of you for listening, and definitely if you haven't as yet, subscribe, leave a review, like this, and share it with a friend. I appreciate you, and I hope that everyone has a great week. See you all next week. Public Health Millennial out.